So today we will discuss about the parasitology buzzwords. I think part 1 is already uploaded. Now we are going to discuss the part 2. So some of the keywords we can discuss here. So first if you come across these words like tachyzoids, bradyzoids, tissue cyst, and the main feature here is Sabin-Feldman dye test. So the tachyzoids is usually seen in acute infection, whereas bradyzoids and tissue cyst is seen in the chronic infections. Okay, so these are the some clues. So the probable organism here is Toxoplasma gondii. So second, there is another parasite where the sexual and asexual stages of development usually takes place in a special vacuole that is called as a parasitophorus vacuole. So if you come across this sentence, then probably it is a Cryptosporidium parvum. So third is, so there is an adoral cilia which is present near the mouth of the organism, and macronucleus and micronucleus. So what is this adoral cilia is nothing but so this organism will be covered by cilia all over the body, and there is a one cilia which is near the mouth. It will be longer when compared to the other cilia. Okay, so that is called as an adoral cilium. So the probable organism is Balantidium coli. So there is another clue, that is it is the largest intestinal protozoa. So next is, if you come across this sentence, that is single-celled anaerobic protozoan parasite which usually resides in the GIT of the human is Blastocystitis hominis. So these are some of the important the clue words. Okay. So if you come across fish tapeworm or human broad tapeworm, the longest tapeworm infecting the man, and it will be causing the vitamin B12 deficiency. The most probable organism here is Diphyllobotherium latem. So next is, so alveolar hydrate disease is caused by Echinococcus multilocularis. Polycystic hydratic disease is caused by Echinococcus aulicorthus or Vogeli, and as you know, the Cassoni test is for Echinococcus granulosus, whereas Sabin-Feldman test it is for Toxoplasma gondii. So some of the other terms, that is a dwarf tapeworm, it is an H. nana, rat tapeworm, it is called as an Hymenelepis diminuta, and double port tapeworm, it is a Diphyllidium caninum. So this is an important, okay. So next is a clinical history. If the patient presents with hematuria, hydroureter, hydronephrosis, and squamous cell carcinoma of the bladder. So if you come across the urinary symptoms, like patient will be developing hematuria and hydroureter, hydronephrosis, and there will be a squamous cell carcinoma, and there is a transitional cell carcinoma of the bladder. But the squamous cell is the most common. The most probable organism is Schistosoma hematobium. You know already. So Katayama fever is caused by both species, that is a Mansoni and Japanicum, whereas Mansoni usually causes a swimmer's itch. So there is a syndrome called Halzone syndrome. It is mainly because of due to the eating the sheep liver, which causes a laryngeal edema and respiratory obstruction. So the organism here is Fasciola hepatica. So next is Oriental liver fluke, Chinese liver fluke, whatever they can give. And the special and important point is it will be having a flask-shaped operculated egg. Okay. Then the most probable organism is Clonarchus sinensis. So next, what is Vacana disease? So it is usually seen in Ancylostoma duodenale, not Necator americanus. So it is present only in the ankylostoma. What happens here is L3 larva is usually transmitted by the oral route, and you can see both the GI symptoms like intestinal obstruction, vomiting, abdominal pain, and you can see the pulmonary symptoms like that pneumonia like pictures. Okay. So next we can, that is an occult filariasis. It is in Weingarten syndrome, and tropical pulmonary eosinophilia. It's a Meyers Guerin syndrome. So next, if you come across guinea worm disease, or there will be a painful papule on blisters, and there will be an yellow serous fluid which is coming from the blister, and there is a test. If you are keeping a leg in the cold water, you can see the worms coming out of the blister lesion. Okay. So the most probable or the organism is Rhacunculus medinensis. So next, if you come across these words like dermatitis, leopard skin, onchocercoma, liver blindness, and there is a punctate keratitis or sclerosing keratitis or snowflake cataract also. Okay. So hanging groin syndrome or mesotic skin test. So the organism here is Onchocerca volvulus. So next, so some of the important parasite causing malignancies. So first, histosoma hematobium, I told you already, squamous cell carcinoma of the urinary bladder. Clonarchus sinensis causes cholangiocarcinoma of the liver, bile duct, and adenocarcinoma of the pancreas. And Opisthorchus wyverni causes a cholangiocarcinoma of the bile duct. So if you come across these words like high-grade fever, hydrocele, chyluria, and transient local edema, and dermatolymphangaitis, or what is that, hydrocele of the scrotum, mostly we will be dealing with lymphatic filariasis. So next, there will be a clue like if you are coming across Tinea saginatum, there won't be no rostellum or no hooklets, whereas solium will be having an rostellum and 2 rows of hooklets. So it is Tinea solium is called as an armed tapeworm. Okay, because of rostellum and hooklet, it is called as an armed tapeworm. Whereas saginata, you can remember like, since it is saginata is nothing but sag. Okay, so it is very loosely attached. If it is very loose, there won't be any rostellum or the hooklet. Okay, so opposite is solium. So if you come across these words, some of the key points, so you can make diagnosis that you are dealing with the probable parasite, and you can choose the correct answer. Thank you.